Okay, so we should talk. There's a lot to catch you guys up on. If for some reason this is your first time at my channel, my name is Christian Kennedy, but you can call me Mr. CK. Okay, so where the hell do I even start? I am currently in the hospital. I'm gonna rewind a little bit. My port placement was on September 9th, and I healed up pretty well from that, and then we turned right around and we went into my first round of chemotherapy, which was me taking venetoclax, which is a pill, and then decitabine, which is an IV. So my first round of chemo was from between September 13th through the 17th for the IV chemo, the decitabine, and I was taking from the 13th on 200 milligrams of venetoclax, which is another chemo drug, right? So we did that, and I'd been on venetoclax for about a month. I've been doing decitabine for the 5 days that they had me in there, and then we were just seeing what happened. And then what happens with chemo is that your body's just shredding cells, right? It's just destroying stuff left and right. So you got to try to drink a lot of water and get stuff out of your system and everything. But with that, we were hoping it was going to kill off a bunch of blast cells and everything, and maybe it did, I don't know. But one of the things it kills off in droves is your white blood cell count. So you end up being neutropenic, which is essentially when you don't have an immune system, you don't have any white blood cells, right? So here on October 3rd, I hit what's called the nadir, which is your lowest point, right? And it's not uncommon at all to have people get what's called a neutropenic fever, which is essentially, hopefully you don't have an infection, but sometimes your body just starts to go through the motions of if you're sick. So I started to get chills, and I was just absolutely shaking so hard. I was really, really cold. And then I got into a hot bath, and I was a little better. And then I got back out, was laying in bed and everything, and I started to get really warm. And I was like, I wonder if I'm running a fever. And so I took my temperature, and it was a little high, and over the course of the next hour, it kind of kept creeping up a little bit. It was like 99.6 or something. And then in the next hour, it got up to 100.5, and then it got up to 100.8. And you're supposed to go into the ER if you are neutropenic. You're supposed to go into the ER if your temperature gets above 100.4. So unfortunately, I had to tell my husband that we had to go into the ER. I had to tell him at 12:30 in the morning, and I was like, yeah, I think I'm having a fever. We need to go to the ER. I know you were thinking about sleeping tonight, but that's not gonna happen. So we went to the ER, and they started giving me all kinds of antibiotics. They beat the shit out of my port. The person in the ER did not know how to do port stuff, and she was manhandling my shit really hard. So she's kind of bruisey right now. But anyways, so after a little bit of being in the ER, they were like, you know what? Because you're so immunocompromised, we really want to make sure that you're okay. So we're going to admit you to the hospital, right? And so they did that, and I stayed in the hospital for 3 days. What's funny is the room I was in, room 16, that I was in for 3 days a week ago, it's the same room I'm in right now. So I'll explain. The 3 days go by. They had to wait to get my cultures back, so they have to take your blood and then make sure nothing fungal or bacterial grows out of it to make sure you don't have any infections. I didn't. So they're like, yeah, it's just a neutropenic fever. It's just your body freaking out because it has no white blood cells, or very few, right? And so it's just running protocols of this usually kills things. If we make things really hot or really cold, it usually kills stuff. So yeah, but at the end of the 3 days, I was going to have a second bone marrow biopsy to see where my blast cells were at, and they were going to do that on Thursday. But since I was there on Tuesday, they're like, let's just do the second bone marrow biopsy, right? Which of course immediately causes me anxiety, because anytime I have any kind of a physical procedure, I freak out. So I will say that this one was actually much less invasive. I don't know if it was because it was on my right side instead of my left. And my left side tends to be a little bit more tender or tight, right? This one was actually not bad. The drug ratio was really good. The Versed worked very well. and I wasn't nearly as sore as I was the first time. So I don't know if that means they did a better job, which is highly possible, and just were less abrasive with it, or if that means that I'm getting a little bit used to getting fucked with, and so I'm like, this might as well happen. Might have to continue this in a minute. Oh, save that for later. So I'm gonna push pause because my IV is beeping. Spoiler alert, I'm actually getting chemotherapy right now, but talk about that in a minute. Okay, and we're back. I had to have the nurses switch out some stuff in my my IV. So basically we got the results back from my bone marrow biopsy, and my blast cells were going in the wrong direction. It looked like my blast cells were going up, so it seems very much so like this MDS that I have is highly aggressive, which sucks. It's not super exciting. But with that, they're like, you're getting really close to having like actually leukemia and like being like dick deep in lots and lots of blast cells. So we're gonna start treating you like you do have leukemia, and we're gonna start giving you the regimen of chemotherapy that we give somebody with way more blast cells. They were trying to be like a little bit nicer to me, right? Because they thought I only had 8% blast cells. But when they took my bone marrow biopsy, I had 18% blast cells. Not great. I'm hoping that they just got like a really blast cell heavy sample, you know. But either way, I'm okay with you know, doing this chemotherapy like we mean it. And so with that though, because we're doing a more aggressive regimen, day before yesterday, they were like, so we need to be able to monitor you while we give you this chemo, so you have to go into like an actual full-on hospital stay for the next 3 weeks. This is fine. Shit. But at least it's safer in here. At least like in my little tiny room, like there's not a whole lot of cross-contamination. The nurses are always wearing like all of their masks and gloves and hazmat suit type looking things. Yeah, so I said so a lot. But that's where I'm at right now. I'm trying to see this as a good thing because I really, really, really would like to kill off these blast cells. We got to get them down, and so that way they're a lot easier to kill off with the bone marrow once I actually do the transplant. There is a possibility that I could go straight from this 3 to 4 week, they said. It depends on how fast I recover after the chemo regimen, which I think it's an 8-day chemo regimen, and then you end up tanking after. So what happens with chemo is they give it to you, and then it still slowly like works on you and screws up your cells for like weeks afterwards. So a lot of bed rest, a lot of water. I do like the fact that they have me on fluids, so that way, even if I'm like not doing the best at drinking water, I'm still getting water in so I can flush things out of my system. But yeah, so that's happening. And also, like I'm definitely gonna lose my hair in like 2 weeks. It's fine. Like I said, I think I've mentioned this before, but I actually don't mind that much. It's gonna be better for cleanliness. So I mean, take your last looks at this badness, because it's gonna go. I feel like it's already thinning a tiny, tiny bit, but maybe not. Maybe that's just me. Maybe that's just stress. I don't know. But yesterday, they were gonna start the new chemo regimen yesterday, but things were crazy here, and I could tell the nurses were just like running their asses off. And so they were gonna put in a PICC line. So I do have my handy dandy little port, which by the way, I have named. I named her Port Royale. I thought about it for a while. I was like thinking of different ports to name her after, like Port de Prince, Port de Leon, and I decided to go with Port Royal because she seems like kind of a royal snobby girl, so I like it. But then they gave me a PICC line, which is the one that's over here. So This is basically an IV that's in your arm. Ooh, scandalous. Dropping that spaghetti strap. Yeah, so this has two lanyards in it, the little things that they put the tubing through, and it's just easier because right now they want to give me fluids through one, and then this is my chemo line. So it was kind of weird. I was nervous about it because everything's been happening so fast, and you know what, honestly, that's probably for the best, because if I had too much time to think about it, I think I would freak right the fuck out, which I kind of do from time to time anyways, because like I got, for those of you playing the home game, I got diagnosed with this shit 46 days ago. So 6 weeks ago, my life was normal. And then all of this happened. And things have been crazy sauce. Not to mention the fact that we also, I'm trying not to cry, and fortunately I'm in a pretty decent headspace right now. But it has been raining shit. Somewhere between my diagnosis and then like all of the stuff I'm going through. And then our son's best friend, who's been his best friend for the last 8 years, this kid was 14 years old and he randomly died of an aneurysm here a couple of weeks ago in the midst of all this shit. And I really didn't want to cry on here, and I'm probably going to, thinking about it, because it's just so fucking sad and random, and in the midst of all of this, like in the midst of all of the shit that I'm going through and that my husband is going through with taking care of me, and my family's going through with taking care of me, and like, and my friends and everybody, and I know that we're not the only ones. Like, it's certainly like really shitty for everyone right now. Like, doesn't it seem like everybody you talk to right now, like, it's just absolutely raining shit on someone? Everybody knows someone who's died lately, you know, sometimes more than one. People are having a lot of like psychological stress, financial stress. Like, it is just wacky out here. And out here, I mean like the world, you know, 2021. You know, and everybody said that like 2020 was the worst, and I gotta be honest, like 2021 is shaped up to be really messed up, and it's definitely a time of change. It's definitely a time of growth. I did oracle cards for myself yesterday, and it was all stuff about like rebirth and change and like accepting new pathways and everything. So I'm trying to take that to heart. I'm trying not to will things, you know? Like, I mean, I have like a will, I have fortitude and everything, but I'm trying not to force my will on stuff, if that makes sense. Like, I'm trying to remain kind of alluvial and okay to deal with change, and accepting of progress through uncomfortable means. So yeah, so I'm gonna start doing a vlog while I'm in here. I don't know what part of it this section's gonna be, or if this explanation's gonna be just kind of its own thing, and then I'll start giving you lead ups. I don't know. I have no idea what I'm gonna do. Again, 46 days. All of this is very new to me. I will give you guys, as much as I can, feedback on the actual chemo drugs and what goes on with them and how I feel and all that stuff. Yeah, it's been a lot. I'm probably going to film some more videos here back to back, because I still have a lot of other things to tell you guys about, and I don't know what else to say. I'm a dunce. But thank you so much for following my channel. Like I said, it really, really matters to me, certainly right now while I'm alone and stuck in a hospital room by myself, and I will be for 3 weeks. So if you can drop me a comment or tell me what you think, literally anything, drop something in the comments. and obviously hit the subscribe button and the notification bell, and help my videos get further out into the world, because that'd be super cool. Yeah, I'm gonna make another video right after this, because I have other stuff to talk about with the whole hair loss thing and with going bald, because I'm just gonna shave off my hair coming up here because I don't want to dick around with it. But anyways, I love you guys. Thank you so much, and I'll just see you in the next video that I come up with, or with whatever the fuck happens in my life, since it is very obvious that I am being taken in a direction. So I'm willing to go there. This is Dumbo. He is my giant stuffy, and he is soft and cuddly, and he makes me happy. And I am a 40-year-old woman with a stuffed animal receiving chemotherapy, and I cannot care less what anybody thinks about that. Like, I give zero fucks if anybody thinks it's immature, because he makes me happy.